If you are experiencing the loss of taste and smell due to a recent or even in the near past COVID infection, I'm going to share with you a very small but potentially influential study that showcases the benefit of one amazing, powerful herb that might be able to completely turn around the loss of taste and smell. So I'm excited to share that with you today. So recently, there was this very interesting and very small study about COVID-19 and the loss of taste and smell. And we know the loss of taste and smell is a common occurrence with an assorted viral invasions and respiratory infections. But with COVID-19, it's more extensive. We're seeing the olfactory epithelial membrane. That's actually this amazing little membrane that sits in between your brain and the upper part of your mouth and your sinus cavity. That is what registers our sense of smell. And then with that, we also see smell enhances taste. We have taste buds that sit on our tongue. The taste buds and the olfactory epithelial membrane are getting overwhelmed by the spike proteins and the ACE2 receptivity that we see overwhelming the body with the COVID-19 infection. And so there are a lot of individuals that are dealing with this. And in fact, there's calculated estimations between 60 and 80% of all COVID infections lead to some degree of a loss of taste and smell. The extent of it varies, but we're seeing about 20% of the patients, and this is because of the quantity of infections, millions of patients right now are dealing with extended loss of taste and smell. 20% have that extended beyond 30 days. So 30 days or more. Some patients I'm seeing have had the loss of taste and smell for 9 to 10 months. And some of them are getting some of those senses back, but in weird ways. Like now it's moved from the loss of smell into this weird phase where they have weird smells. So it'll smell sulfuric or it smells very, very gross. And so that is something I want to address today because this study looks at curcumin, which is turmeric. And turmeric was studied in specifically 2 patients. And again, I want to share with you, this is not an extensive study, but with COVID, I really like to share assorted studies that might be beneficial. And so let's talk a little bit about this specific study. What they identified, 2 different patients, one in their 40s, another in their 60s, that had this extensive loss of taste and smell for over 30 days from a COVID infection. And what they did is they dosed them with 1,000 milligrams of turmeric. And in both instances, within one case, 10 minutes after supplementation, complete restoration of taste and smell. That's pretty spectacular. Now, the other patient had a restoration of their taste and smell within 12 hours of supplementation. Now, does that mean that all of you who might have taste and smell, that loss might benefit as quickly? It's hard to say because it's such a small sample size, but it is worthy of noting the speedy recovery is specifically linked to 1,000 milligram dose of turmeric or curcumin. So curcumin has been studied with COVID-19. And I'm going to share with you, if you haven't grabbed the Turmeric 3D by Organixx, grab that. This is a wonderful, wonderful supplement that has 1,000 milligrams of curcumin and a whole bunch of other powerful immune supportive herbals. Curcumin specifically has been studied to block a particular protease. So it's the M-Pro. That protease, when blocking with a COVID infection, actually limits that spike protein from implanting and rejuvenating. Basically, we see that replication of the virus, it comes down by blocking the protease. So that is one thing that we know from other studies, extensive studies, that curcumin can block that. Curcumin also has been studied in its pro-inflammatory properties or pro-anti-inflammatory properties. It helps to decrease the cytokine disruption or the cytokine storm. That's the technical term for the immune response ends up being an inflammatory response in patients. So what happens, for whatever reason, the way the infection works is, for some individuals, we see them have a ramp up of their immune system. And now that immune system goes haywire, and we end up seeing this massive inflammatory response. It's very similar to an autoimmune response, but very differently in the extent of it. It can be massive. And that's why we see some patients, they come into the ER, they've got oxygen levels of 63, they're talking, and then an hour later, we have to put them on a vent, trach and ventilate them. One of the things that we see is that overwhelm, that specific cytokine reaction, this mast cell and this inflammatory reaction, and it's a very overwhelming inflammatory reaction. It can damage a lot of different tissue and a lot of different organs and systems within the body. And damage, some of it can be short-term, some of it can be permanent. We are seeing the blood-brain barrier leaking. We see the overwhelm of the inflammatory cytokine reactivity in the brain. So we're seeing neurological COVID. And the loss of taste and smell is one of the 3 phases of COVID, neuro-COVID. We call it COVID brain, but neuro-COVID has 3 phases. The first phase that signals that the blood-brain barrier has been compromised is the loss of taste and smell. And that poses other longer-term overwhelming scenarios for folks that maybe, like in my family, on my maternal side, we have a likelihood and a propensity to Alzheimer's and dementia. So that could potentially put you at risk. And I want to share with you how, in this particular study, the curcumin was effective. We see when we add a mega dose, like what you can find in Turmeric 3D, when we see a mega dose, 1,000 milligram dose of curcumin, we see the blocking of the protease, which helps limit if somebody's in an active state. And a lot of times you're going to notice in the infection, that's when you get the loss of taste and smell. So it's most beneficial to be proactive. As soon as you have the onset of the loss of taste and smell, you want to hit it with curcumin. But we've even seen the disruption and the overwhelm of the immune state and the inflammatory response that lasts for months. So the speedy restoration of the epithelial cell wall and the return to homeostasis, meaning a reduction of inflammation in and around the cells of the olfactory bulb and this mucosal membrane, that is where we see the greatest healing. And curcumin in those 2 cases have shown to be highly beneficial. Does that mean that within 20 minutes of taking it, you're going to have complete restoration? I don't know, because we don't have enough scientific data, but it's definitely worthy of taking note and adding a supplement like the Organixx Turmeric 3D into your regular routine. Because if you are dealing with the loss of taste and smell, it is really frustrating. And it becomes really critical that we address the olfactory epithelium and limit the inflammation. So an anti-inflammatory, like we find in turmeric, the base ingredient curcumin, its blocking and its anti-inflammatory properties are highly beneficial. So I'm excited to share that with you today. And please share this information with as many friends or family who you know that have experienced and are currently dealing with this frustrating loss of taste and smell. If we can help folks recover, it can help their sanity. It can help them feel like their vitality is back, that they're feeling better, and life is moving on. So I'm excited to get all of you smelling better, tasting better, so you can live your most optimized wellness and optimized life. And make sure you grab some Turmeric 3D.